Next, Michelle Snyder, Community Engagement Coordinator at the National Forum, is going to interview Mayor Stephen Sherlin of Athens, Tennessee. Mayor Sherlin's commitment to improving community health and well-being has led Athens to become a model city in the fight against hypertension. Through initiatives such as Move with the Mayor, Mayor Sherlin has demonstrated the positive impact of local leadership on cardiovascular health. Over to you, Michelle.
Thank you, John. We are joined today by Mayor Stephen Sherlin from the city of Athens, Tennessee. Thank you so much, Mayor Sherlin, for joining us.
I'm certainly happy to be here. Thank you for having me.
Mayor Sherlin, can you tell us a bit about why you have prioritized heart health for Athens residents?
Well, it's a priority for me because I don't know if you remember or not, I had a stroke myself about 6 years ago, and it was a time that was very difficult for me, and in order to make sure that I'm in the best health and shape that I can be, and also be here for my family and for my community, I wanted to be sure that I got involved in things that would help me to recover from this stroke. It was a long road to recovery, and without all the support that I had, I wouldn't be in this position that I'm in today. I know how important walking just for 20 minutes a day is for your health, and I wasn't able to do that at first, but I encourage everyone to make just those small starts to lessen their chances of heart issues like I had, because it is a difficult thing to overcome.
Mayor Sherlin, thank you so much for sharing those details. I've had the privilege of working with the city of Athens, Tennessee for several seasons of Move with the Mayor now. How do your activities and partnerships, including Move with the Mayor, empower residents to take control of their heart health, including controlling their blood pressure?
Well, I'll have to say that I was a little unsure of how far my abilities would allow me to participate when it came to physical activities when Brianna asked me to get involved in the Move with the Mayor program, because I wasn't sure exactly what I would be able to do as far as exercise and promoting the Move with the Mayor program. And like I said, I had a stroke 6 years ago, and it was a slow process and getting back to the shape that I was in before that happened. And this program has inspired me to push myself, and as I do that, I think about my family and my community, and it helps me knowing what I went through, that they want to support me, and it encourages them seeing me involved in those kinds of things as well. And one of our activities that we were involved in was a half-mile walking. In the beginning, was a half-mile walking loop of our health triangle at our Eureka Trail. This health triangle was sponsored by our local health council and hospital, and it features signs about healthy living and meal portions and the right kind of exercise and the things that you should do daily in order to improve your health. And so while we were walking along this short trail, we stopped to read the signs that were placed all along this trail, which are remarkable. And as we moved on, the conversation steered towards what we were reading on each of those signs. And this particular walk inspired our local senior center, by the way, to start a walking club. And it's something they did on their own as a result of being involved with Walk with the Mayor. And they began to meet weekly. And that, to me, made our efforts in this Walk with the Mayor program a huge success indeed.
The countywide community walking program serves as a part of Move with the Mayor, where over 6,600 miles were walked from 220 participants. That is incredible. Mayor Sherlin, what are some of the other heart-healthy resources provided to the residents in Athens?
Well, of course, as you mentioned, we have all our parks here in the city. It's not just one, but we have multiple parks, and they have trails on them, from short trails to long trails. And we're actually adding on to our park system. Hopefully that's going to take place within the next year. We're hoping to add about 15 more acres to our regional park and add more walking in the nature area of that park. Healthy cooking and living activities with our extension office here in McMinn County is something else that we have a high priority with and for. In our schools, we have we work with the schools and to make sure that the children are getting the right nutrition, and the nutritionists there, they're really good with how they work with these children in our schools. We also hold health fairs here in the city for our citizens. So, there's a lot of things that we do working with the county, and they, if we're not coming up with it, they're coming up with something to come with us, to work with us. And actually, the Move with the Mayor program, even as far as that goes, I even get John Gentry, our local county mayor, to come and participate in that with us as much as I can. It's hard to corral him, though.
Mayor Sherlin, thank you so much for sharing all the fun activities that you've been able to host with Move with the Mayor. How do you address reducing disparities and promoting health equity across your heart health and well-being related programming?
Well, the city of Athens has actually been doing some incredible efforts within our city to make our city more pedestrian and biker friendly. We've added accessible sidewalks in our residential areas that didn't have great access before, that connect to they connect now to our parks and our main transportation ways, and they connect our neighborhoods together. And we had a recreation master plan done some time ago within our entire county, and our residents stated that they actually wanted more trails, and that was one of the first additions that we planned for, adding a walking trail along a creek in a park that's currently being renovated. We also have more plans to extend our already exceptional Eureka Trail, and also following the phenomenal growth and excitement of pickleball, which seems to be a trend throughout the United States. We're improving our current tennis courts to accommodate more pickleball and tennis users there. And we're actually renovating, we're tearing those up and rebuilding them, brand new facilities there. We aim to provide our residents with the best quality, free recreation opportunities to keep our community healthy and happy.
Fantastic work being done in Athens. Mayor Sherlin, you touched on the collaboration and partnership with the County Health Department earlier. Can you tell us a bit about the work you do with McMinn County Health Department and how that collaboration has impacted the residents in the city of Athens?
It's impacted the residents of Athens and the county by our sharing resources and encouraging people to use our free facilities that are available not only to our citizens in Athens, but also in the county as well. And we live in an area that actually is in a low-income gather in the state, and we have people who don't have the opportunities to go and places like Gatlinburg or Pigeon Forge, or maybe even travel to the mountains to do hiking. And we have our facilities here are just phenomenal for people to enjoy the beauty of our parks and our walking trails, and we make that available free through our association with the County Health Department.
Mayor Sherlin, what is one piece of advice you would give our audience to help them get their mayors to promote heart health in their community?
Could give you many, but I'll give you one. One of the reasons that I'm in the position that I am is because I listen. I listen to people, and I want to know what my community wants. not only what they want, but what they need. And I want them to feel supported by those that they elect to office. And so I would encourage anyone to speak up to their city or county officials and stress the importance of open communication and to give suggestions to those individuals for what you want to see in your community, because that's what goes on here. We listen to those in our community as they come forward individually or anonymously, and we bring that up in our council meetings, and we make certain that we address the things that are important to our community.
Mayor Sherlin, thank you for joining us today and sharing a little bit about what you're doing in Athens, Tennessee.
Thank you, and thank you for making this program possible, because it really has helped us to improve the health of our citizens here in Athens, and it got me involved in ways that I'm very grateful for, because if you would have seen me 2.5 years ago, you wouldn't think I'd be sitting here today talking, but I am. And so I am very grateful. And I look forward to what's coming ahead with Move with the Mayor.
Thank you, Michelle and Mayor Sherlin. Your conversation highlighted the profound influence local leadership has on community well-being. The National Forum is pleased that Move with the Mayor is helping you improve health in Athens and McMinn County. After another round of your haiku creativity, we'll discuss improving equitable access to self-measured blood pressure control.
Lifestyle shifts now. Numbers guide our path forward. Myths dispelled, we rise.
This is so easy. Bread and butter medicine. Then why the care gaps?
Before the doctor, food and exercise the key. A strong heart we see.
Blood pressure control, nothing is more important, but must be for all.
Wow. Lines of wisdom flow, tiny poems packed with power. Change is in the air. Next, we welcome Alison Smith, Program Director of Target BP, the American Heart Association and American Medical Association's collaborative to improve blood pressure control. Alison?
Thank you for the invitation, John, and for the opportunity to be with you all. I appreciate the chance to share with you the efforts of the American Heart Association and the American Medical Association to make equitable access to hypertension control the new norm, specifically through self-measured blood pressure policy change and practice resources. I hope that you can walk away from the presentation today with some tools that you and your team can use today. With that, I will dive in and share with you that may not be familiar. Target BP is an initiative of the AHA and the AMA, launched in 2017 in response to the high prevalence of uncontrolled high blood pressure. We are both committed to improving health equity and supporting organizations really through science from the AHA, the AMA, and others, along with the AMA MAP framework to help teams organize their approach to providing evidence-based care. We also assist healthcare organizations in their journeys to improve and sustain blood pressure control through professional education, practice tools and resources, and also providing additional support through AHA or AMA for quality improvement program support. And lastly, we recognize healthcare organizations annually with achievement awards that celebrate your commitment to improving blood pressure control, your adoption of evidence-based practices, and your achievement of high blood pressure control rates for the patients that you're serving. So just starting with the science, I want to recognize the work that AHA and AMA released last year in a joint scientific statement regarding evidence-based implementation strategies to improve hypertension control. This central figure in this publication really highlights some of the macro level structural changes like anti-racism efforts, policy change, and financial efforts, as well as some of the organizational changes that you can make in adopting team-based care models, programmatic solutions for lifestyle change, and other systematic solutions that support accurate blood pressure measurement and management like algorithms and policies and procedures. I also want to highlight that equitable access to self-measured blood pressure and evidence-based use of SMBP can play a pivotal role in driving equity in all of these evidence-based strategies that I will dig into in a little bit. So today I specifically want to highlight our efforts to align SMBP device coverage and care reimbursement policy with the science to address some of these structural barriers. I want to describe some of the standards that could enable equitable care through devices, clinical practices, and data that's needed to support evaluation. I also want to call out some of the tools that help translate policy and science into institutional action, including efforts to strengthen the practice of your team and raise public awareness in the communities you serve. And lastly, I want to add a note on the incentives and the awards for practice adoption and outcomes that we offer. So let's start at the national level. In 2019, we advocated to expand the available CPT codes for providers and care teams to prepare patients for the use of SMBP devices, the review of SMBP readings to make care recommendations and treatment decisions. These became effective in 2020. These codes expanded the available options for billing beyond the existing remote patient monitoring codes, and they created incentives and sustainability for this evidence-based practice, which paved the way for Medicare reimbursement. And the links here provide an overview of these codes if you're not already using them. In related work, the AHA and the AMA have also been advocating for Medicare to cover self-measured blood pressure monitoring devices for Medicare beneficiaries. We submitted a national coverage determination request to the Centers for Medicare and Medicaid Services in 2019. By 2023, we finally secured a period of public comment and a hearing. And walking into that hearing, there was a preliminary decision to deny that coverage. But later, after the hearing, they reversed that preliminary decision. So while that is not a victory, it also wasn't a defeat, and we're awaiting to hear more guidance on next steps. Ultimately, we're seeking a durable medical equipment category designation for self-measured blood pressure devices that's only currently available to patients with end-stage renal disease. So obviously, we're hoping to expand that to include patients with hypertension. I just want to take this opportunity to thank the National Forum for your support in that effort and know that you will continue to advocate with us to expand that coverage. In another national level effort, we also turned to the United States Core Data for Interoperability Standards as another vehicle to expand evidence-based care and access. This committee establishes the basic set of requirements of data elements for interoperability in certified electronic health records. So we made a request to add a field for average blood pressure readings. So an average systolic pressure and an average diastolic pressure as distinct from a singular reading. So following public comment and committee deliberations, we were able to secure the approval of the Office of the National Coordinator for Health Information Technology to include that data element in version 4. We anticipate that implementation to be required sometime after January of 2026, but the exact date is to be determined. So these are just two ongoing examples, one win, one work in progress of efforts to make structural changes that create equitable access for evidence-based standard of care. So in an effort to facilitate more access to evidence-based care, the AMA also established in 2020 the U.S. validated blood pressure device listing. And those devices could then be more readily available, improving access to the standard of care. So this list is populated through a process where manufacturers of blood pressure devices submit their evidence of validation, and an independent review committee assesses these applications to determine which of those meet the validation standards. If you haven't visited this list recently, there are some new features to find devices with features like cellular or Bluetooth-enabled connectivity, extra large cuffs, or devices that are available at lower price points. So we're excited really to see this list grow to more than 80 devices and an increasing number of diverse manufacturers. So I'm going to shift now to the state level efforts. So we've also examined Medicaid coverage for SMBP devices and reimbursement for SMBP care, recognizing Medicaid is really a critical driver of access to care. The AMA just updated a 50-state analysis that's summarized here, reflecting that half of states now reimburse for services to get care started with self-measured blood pressure using these CPT codes. 22 reimburse for ongoing monthly care, and 42 states now cover the device at some level. And you can see here in the illustration that each state is illustrated in this report describing the amount of coverage and if and by how much it's reimbursed. If we sort of step back, though, and look at this coverage map, it illustrates an overview where the dark purple states are those that reimburse for device coverage and the service and the device. Those that are in lavender provide coverage for the device. Those in gray provide coverage for the service. Those that are in white cover neither the device nor the service. And those with the dots also have coverage for an additional cuff that's appropriately fitting, for example, if an extra large cuff is needed. We're really excited that this map has changed since the last time it was published. And in 2023, the wins that we've had, regulatory wins, are reflected here, where Kansas, Kentucky, Louisiana, Pennsylvania, and Georgia now have coverage that improved access to more than 500,000 enrolled adults with hypertension who are Medicaid beneficiaries across those states. Now we're developing state-specific policy implementation toolkits to help navigate Medicaid and its managed Medicaid plans in each of those states to help really secure those benefits that may have specific guidance around procurement or access requirements for eligibility or authorization. This map also serves as a way for us to prioritize our state-level advocacy efforts, and the AHA works in states across the country to improve access to evidence-based care. So I'm going to shift now to institutional policy. Institutional policy is just one way that we can drive equitable access to care in the patients that we're serving directly. Last year, we released this blood pressure measurement policy and procedure as for an institution to define a standard of care that they're committed to delivering and how they plan to achieve that. It begins with committing to only use validated blood pressure devices. So by procuring and maintaining validated devices, either for in-office devices or home use, you're committed to creating equitable access to care. This template goes on to set a standard for training your team every 6 to 12 months, as the guideline outlines, and also helps enumerate the steps for acquiring an accurate blood pressure measurement through a standardized process, all of which are recommended guideline activities. So this is a way in which institutions can walk the talk and adopt institutional policy to improve access and equity. We also have tools to support your team in developing and strengthening your SMBP programs. This SMBP Quick Start Guide, as we call it, is a tool that curates a suite of resources that help you assess your practice, strengthen your team's knowledge and skills, and then equip patients for success and self-measured blood pressure monitoring. Here are a few examples of those tools. Training videos for patients that are available now in English and Spanish, along with some take-home resources that illustrate proper positioning and help patients record their readings in an evidence-based cadence. These are, as I mentioned, all available now in English and Spanish, and within the next month, we will make the handouts available in 15 different languages, which we think is a major step forward in providing equitable access, all of which are freely downloadable on Target BP. In another effort, we have the Release the Pressure campaign. It's an effort to raise public awareness, encourage self-care, and make heart health a priority for among African American and Black women. This is led by the AMA and the AHA, but also the AMA Foundation, the Association of Black Cardiologists, the Minority Health Institute, and the National Medical Association. This campaign acknowledges that 50% of Black women over age 20 have high blood pressure, and nearly 80% of Black adults who have high blood pressure don't have it under control. We continue our commitment to raising public awareness through this campaign with practice tools and resources to help improve self-care. And lastly, I just want to touch on our annual Target BP Award program that we've launched back in 2017 and has grown to now 1,800 organizations participating who serve 8.6 million patients with hypertension. And again, we want to acknowledge organizations who are committed to improving blood pressure control, those who adopt evidence-based practices, and those who achieve high control rates. We're excited to expand our award criteria in 2025 to include evidence-based activity adoption awards related to the MAP framework and including self-measured blood pressure monitoring and efforts to improve equitable health outcomes. And that will include attestation of evidence-based practices, but also the use of race, ethnicity, and social determinant data to stratify your control rates and look to see if your organization is achieving equitable health outcomes and using that data to close those gaps and improve control. So with that, I want to encourage you to take action by visiting targetbp.org, taking advantage of the newsletter, educational resources, practice resources, and registering really to be part of this growing community. The data deadline for submission for this year's award is about a week away. So I encourage you to participate and recognize the great work that your organization is doing. I hope this overview of our policy and practice efforts will help your organization take action to use self-measured blood pressure monitoring to achieve equitable health outcomes. Thanks very much.
Thanks, Alison. Anyone who's ever had the privilege of spending time around Alison, I think just feels her commitment and passion for improving cardiovascular health for everyone. So let's all, with what she said in mind, let's all carry forward the valuable insights that Alison shared and work toward implementing actionable strategies to enhance access to essential healthcare services. Nothing can be more essential than hypertension control. Now we have the opportunity for a Q&A session featuring Alison Smith's colleague, Dr. Greg Wozniak, who is Vice President of Health Outcome Analytics at the AMA, and my National Forum colleague, Michelle Snyder, Community Engagement Coordinator with MoveWithTheMayor. Please submit your questions through the Q&A feature. Some already are coming in, several already have come in. We have a question from Karen Hacker from the National Center for Chronic Disease Prevention and Health Promotion at CDC. She poses a question for Michelle. She said, Mayor Sherlin mentioned infrastructure changes like accessible sidewalks and park trail expansions. How do those changes improve heart health and overall well-being in Athens? And follow-up, do these infrastructure changes improve access for residents who face barriers accessing traditional exercise facilities or activities?
So Mayor Sherlin and his team have been really instrumental in making sure that the residents in Athens have the option for many different programs. So when he talked about the Eureka Trail, that has been a pivotal trail for some connectivity between different cities within McMinn County. So they made that accessible to many different areas. But one of the really great things that they've done is they've taken things like a Happy Hikers program, which worked on a health triangle. So they knew that they really had to focus on the residents in Athens who were going to be coming out to these parks and recreation centers and making sure that those infrastructure changes were in place. And so because they have a strong partnership with McMinn County Health Department, they were able to take those infrastructure changes. They've done several community health needs assessment above and beyond what the typical sometimes 3-year countywide level assessment is. And they actually assess the residents of Athens to make sure that they were meeting all of those, not only infrastructure needs, but the complete needs of the community, and look at the community as a whole and what their health and wellness benefits that they could include for, Athens, Tennessee.
All right, very good. Thank you, Michelle. The next question, Greg, is for you. It's from our friend and colleague, Keith Ferdinand from Tulane. And Dr. Ferdinand says the latest national guideline has class 1A for self-measured blood pressure, and it's clear SMBP improves hypertension management. Is there a business case to implement SMBP?
That's a good question, and a question we get many times. And there's several different ways you could think about that. And Dr. Ferdinand, thanks for that question, by the way. In terms of thinking about the business value or business case, you can think about different ways that dollars may flow to different actors within self-measured blood pressure monitoring programs. So, for example, in Alison's presentation, she mentioned CPT codes. So just to take 997473 and 99474, those are codes that Medicare, Medicaid, and even commercial payers reimburse for. So for utilizing those codes, there's dollars that flow into the practice or into the clinic. We've also done calculations on the return on investment from the payer side for SMBP. And we find that there's both short run and long run return on investment for the use of a self-measured blood pressure monitoring program. And keep in mind, when we talk about programs and monitoring, we're really talking about distributing devices, educating patients, educating teams, implementing the readings into, hopefully into the EHR, and using those readings from SMBP devices into clinical decision-making. So sometimes you think about self-measured blood pressure and it's like you can drop a device into somebody's home and it somehow creates benefits in terms of improving blood pressure control, but it has to be coupled. And the evidence, as Dr. Ferdinand mentioned, the evidence is that it has to be coupled with other interventions like education, training, et cetera, and implementation of those readings. So again, there's several different ways to look at the value of having SMBP program monitoring, as well as think about how improvement in blood pressure may play into pay for performance programs, into MIPS programs, into commercial payer programs, where improving blood pressure control has a direct impact on reimbursements and potential in savings programs.
Thanks, Greg. Hattie Reese-Hanley from the Right Care Initiative had asked a similar question about financial incentives to medical groups for using target BP to raise their hypertension control rates to the 70% target. And I think you answered her question as well. So thank you very much. Dr. Ferdinand notes that the empowered patient will adhere and increase change behaviors and adherence. So patient empowerment certainly is important. Michelle, let's see, we have a question for you from Dave Shapiro, who asks, how can we leverage this program with mayors to suggest and influence mayors in other towns and cities around the country?
So first, to answer that question, we welcome mayors from all cities and towns to join the Move with the Mayor program. What each city does is unique because we really look to the mayor as the change agent in that community to determine what that community needs. And so every program, every Move with the Mayor incentive looks different for every city. So the best way to handle that is we really love partnering with local health departments. We love partnering with mayors in different communities. So reaching out to a local mayor and suggesting Move with the Mayor programming in their city is the best way for us to work with them to partner with those cities to implement the programs. Mayor Sherlin's able to host several events a year in partnership with Move with the Mayor. He does host some in the fall and some in the spring, and some of them are really fun and unique events. Popsicles in the Park is one that he does, as well as a toddler walk, which he just recently hosted. So partnering with Move with the Mayor allows mayors in these cities to be that change agent in their community.
Thank you, Michelle. We emphasize a lot and Move With The Mayor, evidence-based programs, policies, and services. And we have a question from Edgar Lopez Baez, who says, I work with community health workers across the state of Washington, particularly in rural communities. And I've noticed the evidence-based programs are great, but sometimes they do not adjust to programs in these communities. And requirements sometimes don't match with the activities and priorities in these communities. What's the best advice to implement evidence-based programs in all communities without infrastructure?
That's a really great question, because when we look at health equity, we look at those infrastructure changes. And what I would say to that, John, is just this idea that our communities that we're working with on the Move With The Mayor programming are specific and unique. And so we really do look at the many different partnerships that those residents have in the community to determine what is going to be the best need to create that evidence-based outcome for those communities. And so it looks a little bit different for every community, but you're right, community health workers play a vital and important role. And we definitely work with community health workers when we look at some of the cities who are having successful strategies in not only infrastructure, but things like health equity and accessibility, and try to determine what they're doing in that community that other mayors can take part in and replicate in their communities. So it's pretty wide across the board. I don't think there's one specific answer that works, again, like for every community, as you discussed. But I think the important thing is we can find those partnerships within those communities so that residents can not only improve their health, but also really take a look at empowering themselves for that health equity piece of it as well.
Thanks, Michelle. Greg, Judy Hannon with the Million Hearts Initiative, Judy's at CDC, pointed out, following up on your answer before, that there's a document on the Million Hearts website. We'll put the URL in the chat, but a document that shows how through billing to Medicare, one can likely recoup costs for a hypertension control program. Are there other documents or other examples that you would call the attention of clinical practice decision makers to help them see whether undertaking hypertension control, making that a priority, is sustainable for them?
Well, John, say thanks, Judy. Yes, CDC has materials, NAC has materials around what those benefits would be in terms of dollars, with some sort of use cases, and we've helped on some of those calculations. We've got various materials, and I can put in the chat a paper that we published that has some of the ROI calculations that we've worked through for SMBP, and thinking about where and how a quality improvement program, blood pressure, can be sustained. We have seen that in terms of quality improvement program that we've implemented within the time period of the implementation, as well as post-implementation or some sustainability or maintenance period, blood pressure control rates improvement has been sustainable. But again, it's different programs have different sort of aspects, but generally we found that there is a positive value in terms of improving blood pressure control. But I can drop in the chat a couple links for those resources.
That would be great. Thank you. And I can add to that, you're very modest, Dr. Wozniak, but I can add that there are several very good papers on which Dr. Wozniak is an author that I think would be very useful for those who have an interest in the business case or the sustainability of hypertension control in a clinical practice setting, different types of practices. So thank you, Dr. Wozniak. Thank you, Michelle, for your contributions to our discussion today. Let's all continue to leverage local leadership and innovative healthcare initiatives to drive meaningful change and improve health equity for all individuals.